90-day university. This is a 90-day program in which we will be mastering pathology, and it will consist of revision of all important topics which are asked in your university exams, and we will be trying to quickly revise all important facts, which are mostly, pathology consists of mostly vast information which are extremely volatile, and we will be trying to continuously reinforce all these facts to you so that it will be retained properly. And we will be discussing all high yield topics from the subjects which are most commonly used asked in your university exams. And not only for your university exams, these classes will also be useful for your next exam and upcoming NEET PG exams. And the most important thing is, it is also important for your practical exams, not only your theory exams. So the Auricle's Pathology Orientation 90-day mastery program, it includes live classes as well as recorded classes also. Okay. My name is Dr.Guru Priya, and I will be your pathology educator this year. And my goal is nothing but to make this complex subject of pathology easy for everybody to understand. I will try to break down each topic so that it doesn't seem very much vast and very much incomprehensible to you. So what is the good thing about Auricle? What are the great features which are there in Auricle? We have recorded classes which you can go log into the app, subscribe, and then watch these recorded classes anytime you wish to watch. There are live classes also which are scheduled, and they have very much high yield topics which are frequently asked in your exams. So every live class is framed in a way that it has questions and practical sessions and all important things which you will have to know for the exam. And all these unimportant topics, so-called, will not be discussed in your live classes. So you will have reinforcement of these topics again and again so that you can perform extremely well in your exam. And there are practical sessions also. Practical sessions, this is a very important and core feature of Auricle. There are many educational platforms where you can get live classes, even recorded classes, MCQ modules, etc. But practical sessions is something which is a very important and core feature of Auricle, where you can immerse yourself in a practical exam-like experience, and you can also learn concepts which are important in performing in your practical tests. And there is an exam-like module also. This exam-like module also covers frequently asked questions in your exams. You can go through and revise these exam questions before going to your exam. So this will have previous year's papers, which will be very useful for your revision. And now everything has become PDFs and online apps, everything, but still hard copies are a very good way to read, underline, mark, and retain your memory. So hard copy is where you can retain your memory, even though you have all these PDFs and everything. Hard copies are the best. You can mark in them, you can go and revise in them very easily. It's very handy. So hard copies are also available. Recorded classes are very useful for our flexible learning. Whenever you are reading something and there is a concept which there is a lack in the concept, you can quickly go into the recorded version of the lectures and look into it. So just the portion, even the simple single portion, if you want to look into it, you can conveniently look into it and revise it very quickly. So the content is extremely updated and very high yield for the exams. There are live classes also, as I already mentioned, and live classes have interactive MCQs. It's very interactive. So if you have any questions, you can actually ask then and there. While teaching, if you feel that, okay, this is not very clear, if you ask, it will be cleared very quickly. So recorded lectures won't have that kind of facility. So that is a very good thing about interactive live classes. Also, we'll discuss MCQs, case-based questions. Also, we will be discussing how to solve a case scenario. Case scenarios are very commonly used in our exams, and it can be very confusing at times to solve them. So, how to differentiate one case from another, how to solve these case scenarios, and how to, and conceptual clearing, these things are done in our live classes. So exam module has quickly revision and complete coverage of all the exam type questions, and you will also be oriented towards how to write an exam. You cannot just write a paragraph. So how to break it down into flow charts and make it into tables. So those things will be taught. And also hard copies, it's as I already mentioned, the importance of hard copies. So we use a very unique teaching approach. The thing is, we do not just read textbooks. Given there is a textbook, so we do not randomly read all the textbooks. What we do is we use mnemonics to break down and easily understand and learn any case. And case studies also we use, because case studies are very important. Every exam they ask case studies. Also visually diagrams for pathology. In fact, visual memory is very important. So I will be using a number of cases, pathology slides, and also flow charts to explain in the further classes. Also in live classes, any doubts, whatever doubts you have, you can just ask, and I will try to clear it on the spot. We have a question bank also. Question bank has 3 levels of expertise. Like a beginner level is there, an expert level is there, and it can be customizable. You can choose whether you want a hard question or a customizable question bank. If you want a very easy question, that also you can customize. So these can be useful even in your prof exams. MCQs are asked, and also neet PG MCQs are asked. So this will be a training not only for your prof exams, but also until your neet PG, and even beyond that, these can be useful. Practical sessions, as I mentioned, practical sessions are very unique to Auricle, especially because practical session, they are designed to provide hands-on experience and in-depth understanding of concepts, which are usually taught theoretically, but application is very important in practical sessions. So we teach you how to apply all these things in real life, and how to do your practical exams, also how to do your practicals when you're practicing as a doctor. Pathology, as we know, is extremely vast. It's very theoretical. It has lots of names, jargons, and all these things which will be commonly asked in your exam. Examiners love asking all these things in your exam. But at the same time, it is extremely hard to retain all these things. So what my intention is reducing all these jargons and trying to make it very simple, and make it a very basic language, so that everybody can understand and grasp your concepts. So if concepts are clear, pathology is something which will be useful in your medicine when you go forward, in your surgery, in your obs gynae, and it is truly important in every subject. So any subject in your clinical subject, if you go forward, you need pathology for the correlation. So these modules will be framed in a way that it has hematology, histopathology, and cytopathology. Also, it is very up to date, as I already mentioned, and it can be used for your university exams, NEET PG, and also even beyond that. So mostly in our live interactive sessions, I will be trying to include as many as interactive mock discussions as possible, in many MCQs and practical sessions as possible, so that it gets as interactive as possible, and any doubts also can be cleared on the spot. So these are our subscription plans, which you can go and go to the app and look into the subscription plans. I just want to discuss a case scenario. So shall I go ahead and discuss this case scenario? Hello? 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 Okay. So I'll just go ahead and discuss a case scenario with you all. It is just a simple case scenario for the understanding of how our classes will be framed, and mostly you might get questions of this sort also in your exam. So let's explore this case scenario with a real world example to understand how inflammation works. This is a very common clinical scenario which we encounter in our daily practice, and even we get it very commonly in our pathology lab as well. So this is a case of a 24-year-old male who presents to the emergency department with severe abdominal pain. Okay. So the complaint of this patient is he presents with sharp cramping pain in the lower right abdomen, which has started 12 hours ago and has progressively worsened. Okay. So he has no significant past medical history, but he has nausea and slight fever, but no vomiting. So when physical examination is done, he has tenderness of the lower right abdomen. Rebound tenderness is also there. Rebound tenderness, as you can remember, I just explained a little bit about rebound tenderness. It's nothing but when you press the right lower abdomen, there is pain. But when you take your hands off the patient, even then there is tenderness. So that is called as rebound tenderness. Guarding is also present. Guarding is a very hard and non-palpable abdomen. That is what. So in blood tests, when you see there is increased WBC count, which indicates an inflammatory response. Ultrasound shows an enlarged and thickened appendix with localized fluid collection, suggestive of an inflammation. CT scan actually confirms acute appendicitis with signs of inflammation, including appendiceal wall and surrounding fat standing. These are all important features to be noted. So, the surgeon has operated and we get a appendix specimen in our lab, and it shows intense neutrophilic infiltration of the wall of the appendix with fibrin deposition and cellular debris. These are all classic signs of acute inflammation. I'll be explaining each one of these, so don't worry about that. So this is the slide which we have got. This is the section of appendix. Appendix looks like this, and this is the lumen of the appendix over here. Here we can see pinkish material, and there is blue material over here. These blue things are nothing but lymphoid follicles. So appendix has these lymphoid follicles. So when we see in a higher cover, we can see there are numerous cells over here. These cells are nothing but neutrophils. You might remember a neutrophil from your physiology. So a neutrophil has multiple lobes, okay, and it has few granules in the cytoplasm. In this comparison, you might also remember a eosinophil, which is actually bilobed, and it has orangish granules in the cytoplasm. And also a basophil also. This is just a revision from your physiology. So a basophil which has a bluish black nucleus, and it has the blue granules in the cytoplasm. So here whatever we see, these are all neutrophils. So what is the significance of this neutrophil and what is the significance of this case? So for this we have to learn the signs of acute inflammation. This is a very beautiful image which this image you can actually remember as such. So these are the 5 main signs of acute inflammation. Heat, that is the patient will have redness. Heat, that is the patient will have an increased temperature. So that is what heat means. And then the second one is redness. Redness is the patient will have redness in the area of inflammation. And the next one is swelling. Swelling of the organ or part which is associated. Okay, so heat is there, increased temperature, redness, which means the part which is affected will be reddish and swollen, swelling. Okay, patient will present with pain. Pain is very important sign of inflammation. And then the part which is affected will lose its function. So that is the last thing. So this image, if you remember as such, this will clear most of your inflammation questions. So first thing is patient will have increased temperature, and then the part which is affected will be reddish in color, and then the part which is affected will also be swollen, painful. The patient will present with pain, and then there will be loss of function of the organ involved. Now let's just go back to the case and see if these findings are there. So this 24-year-old male, he presents to the emergency room. He has severe abdominal pain. So he has pain. And then he reports with nausea and he has increase in temperature also. And then tenderness in lower abdomen, which is again pain. Okay. So elevated WBC. So what happens is when inflammation is there, when there is increase in temperature, there are certain molecules which are released and those increase the white blood cells. Okay. So these are all the important functions of inflammation. Now let us see what are the key inflammatory changes which are seen in this patient. So we will be discussing all these things. This is just a very small introduction on how our classes will go in the future. So vascular changes like increased blood flow and permeability. So that is the reason for our redness. Vascular changes like increased blood flow and permeability, and cellular events such as neutrophil migration into the appendix. Okay, so we can see that there is numerous neutrophils in the appendix over here, and neutrophil is a marker of acute inflammation. So there are numerous neutrophils over here in the image. Increased WBC count also, and when you do a WBC count, when you collect the blood, also you can see increased neutrophils in the blood. Okay. So next thing is, how does acute inflammation help and harm the body in this scenario? It helps by targeting and isolating infection, but excessive inflammation can lead to abscess formation or rupture, worsening the condition. So what will happen? We saw that loss of function is a sign of inflammation. So in this case, appendix, when the swelling increases, the fluid collection and swelling increases, appendix can finally burst and it can result in ruptured appendix. So that will result in loss of function of appendix. So what clinical signs indicate acute inflammation in this case? Pain, swelling, tenderness, fever, these are all direct results of inflammatory process. These things we have already discussed. How would you manage this patient? So the treatment would be surgical removal and antibiotics. Since we know there is acute inflammation and infection, to control the infection, we would give antibiotics.